Hello guys, so this is just a review, a pharmacology review on anxiety medication, and I'm just making this video so that there's something I can listen to while I'm in the car, so I can study while I'm driving in my car. I do a lot of long drives, so I like to listen to myself study. So this is just a quick PowerPoint on anxiety medication. Anxiety disorders include generalized anxiety disorders, panic disorders, obsessive compulsive disorders, social anxiety disorders, and post-traumatic stress disorders. And also, a little side note, all the notes are derived from ATI, Pharmacology and Nursing Process, and Pharmacology Nursing Made Easy. Alright, let's continue. Manifestations of anxiety disorders include fear and apprehension, palpitations, tachycardia, and shortness of breath. Interventions for anxiety disorders include therapy, biofeedback, relaxing techniques, and of course medications. Drug classes for anxiety include sedative hypnotics, anxiolytics, benzodiazepines, atypical anxiolytics or non-barbiturates, and selective serotonin reuptake inhibitors. Benzodiazepines. Examples include alprazolam, Xanax, diazepam, Valium, lorazepam, Ativan, and clonazepam. Purpose? Benzodiazepines enhance the inhibitory effects of GABA in the central nervous system. Relief from anxiety occurs rapidly. For generalized anxiety disorders and panic attack disorders. Complications include CNS depression. Advise patients to notify provider if sedation, lightheadedness, ataxia, and decreased cognitive function occurs. Avoid operating heavy machinery. Avoid alcohol and other anxiety medications. Other complications include anterograde amnesia, drowsiness, and slurred speech. Toxicity causes drowsiness, lethargy, coma, and confusion. For oral toxicity, gastric lavage is used, followed by activated charcoal. Administer flumazenil for benzodiazepine and monitor vitals. Overdose is normally treated with IV flumazenil, which is a benzodiazepine receptor antagonist. Withdrawal effects of benzodiazepines include anxiety, insomnia, diaphoresis, tremors, lightheadedness, delirium, hypertension, muscle twitching, and seizures. Advise patients to taper dose over several weeks. Contraindications of benzodiazepines are pregnancy risk, category D. They are scheduled for patients with sleep apnea, respiratory depression, or glaucoma, liver disease, or of the older age, or advise or caution or taken with caution. Interactions with benzodiazepines include CNS depressants such as alcohol, barbiturates, opioids, anticonvulsants, and antihistamines. They all potentiate respiratory depression. Grape juice will reduce metabolism. High-fat meals can reduce absorption. Contraceptives will enhance CNS depression. And rifampin enhances clearance and reduces the therapeutic effects of benzodiazepines. Administration. Please take as prescribed. Taper dose after taking in long periods. Administer with meal or snacks if GI upset occurs. Administer at bedtime. Evaluate memory and monitor vital signs of withdrawal and dependence. I wrote that twice, that's a typo. Atypical anxiolytics non-barbiturates include buspirone, Purpose of buspirone, how it works is it binds to serotonin dopamine receptors with less occurrence of dependency, sedation, or CNS depression. Anti-anxiety effects develop slowly. Initial response takes at least 2 to 6 weeks. For panic disorders, social anxiety disorders, OCD, and PTSD, those are the indications. Complications of non-barbiturates of buspirone are dizziness, nausea, headache, lightheadedness, agitation. Please advise the patient to take with food to decrease nausea and avoid operating heavy machinery. Other complications include constipation. Advise them to increase fiber and fluid intake. Suicidal ideations. Monitor and report manifestations of depression and thoughts of suicide. And also, insomnia is another complication. Contraindications are pregnancy risk category B, not recommended while breastfeeding, older adults with liver or renal dysfunction, patients who are already taking MAOI antidepressants due to hypertensive crisis, and history of hypersensitivity to buspirone. Interactions of buspirone are erythromycin, ketonazole, St. John's wort, and grape juice, which all increase the effects of buspirone. Selective serotonin reuptake inhibitors, or SSRIs, increase the risk of serotonin syndrome. Serotonin syndrome symptoms are fever, tremors, diarrhea, and delirium. If MAOIs are taken within 2 weeks, it can cause severe hypertension. Administration of buspirones should be with meals to prevent gastric irritation. Advise patients that effects do not occur immediately and are normally noticeable within the first week and full effects within 2 to 6 weeks. Tolerance, withdrawal, and dependence of buspirone are not concerned, they don't occur. And also begin fall precautions for older adults taking buspirone. Selective serotonin reuptake inhibitors, examples include paroxetine, sertraline, citalopram, escitalopram, fluoxetine, and fluvoxamine. Purpose: paroxetine selectively inhibits serotonin reuptake, which allows more serotonin to remain at neural junctions. Does not block dopamine or norepinephrine receptors. Long effective half-life and 4 weeks is necessary to produce therapeutic effects or therapeutic levels with serotonin reuptake inhibitors. The indications for SSRIs are generalized anxiety disorders, panic disorders, OCD, social anxiety disorders, PTSD, dissociative disorders, and depression. Complications are early adverse effects include nausea, diaphoresis, tremors, fatigue, and drowsiness. Instruct patient to report to provider, take as prescribed, and effects of early adverse effects would subside. Later adverse effects involve sexual dysfunction. It can be managed with lower dosages of SSRIs or changing medications. Other complications include weight gain. Advise patient to follow a balanced diet and exercise regularly. And there's also GI bleeding. Avoid patients with history of GI bleeds and ask the patient to report if dark stools are produced. Other complications include hyponatremia, and it's more likely to occur in older adults. You should take baseline serum sodium levels and monitor sodium levels throughout therapy. Serotonin syndrome can occur. Symptoms include agitation, confusion, disorientation, difficulty concentrating, anxiety, hallucinations, myoclonus, hyperreflexia, tremors, fever, and diaphoresis. Bruxism can occur with SSRIs. Can treat with low-dose buspirone. Advise patients to use mouthguards, or switching medications is a possibility. SSRI withdrawal can occur. Symptoms of withdrawal include nausea, sensory disturbances, anxiety, tremors, malaise, and uneasiness. Can be minimized by tapering the dosage when quitting, and advised not to discontinue abruptly. Other complications are post-dural hypotension, monitored by taking blood pressure, and suicidal ideation. Report to a provider if you notice any symptoms. Contraindications are pregnancy risk category D, patients taking MAOIs or tricyclic antidepressants. Patients taking paroxetine should avoid alcohol, and paroxetine is used cautiously with patients who have history of liver and renal dysfunction, seizure disorders, or history of GI bleed. Interactions of SSRIs, MAOIs, or tricyclic antidepressants can cause serotonin syndrome. Antiplatelet medications and anticoagulants can increase risk for bleeds. When administering SSRIs, you can take it with food, should be taken in the morning to minimize sleep disturbances, be taken on a routine basis to establish therapeutic levels, consumption of fiber supplements at least 2 hours before or after dosing of medication, because fiber supplements can decrease the absorption of SSRIs. When evaluating the effectiveness of anti-anxiety medication, patients will verbalize feelings of less anxiety and act more relaxed, will have improved moods and mental alertness, have improved memory retrieval, can maintain regular sleep patterns, and will have noticeable improved ability to cope with identifiable stressors. If you are watching this, thank you for watching. If you want me to make more videos, just let me know. Yeah, and good luck studying and becoming a nurse. Bye.